Thank you very much for the kind introduction. Any of you have been in Cirque du Soleil? I have, and I know I cannot do those acrobatic acts. Most people do not associate my physical appearance as being of a breast surgeon for 30 years. Few women were trained when I started. So I like to begin to share my personal journey becoming a surgeon. It is a story of opportunity and a passion. I was a good student in biological sciences. In college, received a fellowship to University of Cincinnati. By chance, a new program was developed in University of Cincinnati and Children's Hospital in molecular biology. After receiving my PhD, I received a fellowship to continue basic research at Roche Institute of Molecular Biology and the National Cancer Institute Lab of Cell Biology. After several years, I returned to Cincinnati to marry. I lost my job and decided to matriculate in medical school. Even though I have spent many years in basic molecular research, the subject that captured my imagination in medical school was anatomy. So consequently, I entered a surgical residence training program and started to practice general surgery in the local community hospital. Early days when I first started as a breast surgeon, the hospitals do not even have changing facilities for women surgeons. At the time in Cincinnati, there is another female surgeon. She invited me to join her in the breast consultation center. She was a pioneer in patient-centered, medical science-based care of bringing a team of physicians and nurses together care for breast disease. At the time, it was really women physicians taking care mostly women patients. And I think the women physicians can relate on emotional levels probably better with their patients. There is certainly no difference between the medicine and the technical level between men and the women. When I first started practice breast surgeon, diagnosis and treatment of breast cancer is mostly based on low-resolution mammogram and the removal of the tumor and the mastectomy, followed by a long course of chemotherapy and radiation therapy. The first significant observation was that early diagnosis is related to survival. The next 20 years, the next 20 years, 25 years, the advance of the technology in imaging has brought us 3D mammogram, contrast-enhanced wrapped sequence breast MRIs for us to look at the breast screening. And the advance in genomic biology helped to identify specific genes which lead to cancer and the better appropriate treatment by using specific cancer drugs. Surgical technique also improved. So we can only remove the tumor without removing the whole breast. So as a lumpectomy versus a mastectomy. To stage the breast cancer, we can identify specific lymph node and excise which the lymph node is closest to the tumor. Clinical studies have shown that just removing the tumor, a lumpectomy, compared to mastectomy to remove the entire breast, the survival rate is the same. That still leaves a long course of chemotherapy and the radiation therapy. However, two more recent discoveries now is in clinical usage. One is target therapy. The second one is immunotherapy. Target therapy acts on each cancer's gene specifically, and the immunotherapy actually allowed patients' own immune system to recognize the cancer cell and kill the cancer cells. Today, the 5-year survival rate for early diagnosed breast cancer is over 95%. Screening and diagnosis in early account to 1/3 of the survival rate improvement, and treatment account to 2/3. Let me share with you a case to give you a more personal view about change of breast cancer treatment over the last 25 years. I met my patient Julie in early 1990s, and she was in her early 30s. There's no family history of breast cancer. And she found a relatively large lump in her breast. She insisted that I'm not going to lose my breast. Her strong conviction helped me to make the decision to perform a surgical lumpectomy, followed by radiation and chemotherapy. And after 2 or 3 years of her treatment, she decided to become a mother. And that made me very nervous because at the time, I do not have any knowledge about pregnancy and treatment of breast cancer. Looking back, if I had the knowledge of current oncoplastic breast technique, her post-mastectomy cosmesis could be better. The cosmesis of her breast could be further improved with the current new radiation technique. Julie's tumor's molecular type may indicate she does not need chemotherapy without compromise her chances of survival. Better understanding of her genome may better for us to tell her whether she carries a cancer gene or not. When the genetic testing was first available, she declined the test. As her daughter grew, she decided to have the test because she wanted to do it for her daughter. And thank God, her test is negative. Moreover, now, with more advance in screening, if another cancer does arise, early diagnosis, we can optimize her survival. Today are now many women surgeons in U.S., and the breast surgery actually is on the verge to be recognized as a surgical specialty. Since I trained, the rate of the cancer survival has increased 1% per year since 1990s in U.S. Over the same period of time, China has shown very little improvement. And this is true in the cities and the rural area. However, the rate of the cancer detection has remained constant over the last 10 years in U.S. Whereas in China, the breast cancer detection rate is still increasing. A closer look at the cancer practice does reveal some differences between American and Chinese cancer programs. First, there is a great emphasis on screening and early detection in U.S. We are focused on precision screening based on each patient's risk factor for developing breast cancer. Early detection also reduced the needs for mastectomy and the better options for patients for treatment. This translated to better outcome and quality of life. Second, when patient is diagnosed with breast cancer in the US, he or she starts a life journey with the teams of physicians and the nurses. The team approach provides an easier path for physicians to keep abreast with all the new information about cancer, and also brings the resources to deal with all the problems potentially associated with the treatment. Patients also involved in awareness, cancer awareness, and even raising monies for cancer research in their own community. In many ways, patients are partners for life with their physicians. They teach us how to face adversities while maintaining their dignity. Leaving my practice was a very difficult event for me. I could not say goodbye and tell my patients, all of them, I'm coming to China. And I also could not face all the tears. Nevertheless, I decided to come to China because I want women to empower to take care of their own health. Together, I hope we can build a breast cancer program here, are patient-centered, science-based, and research-driven. During preparing this talk, I received a letter from Julie, and which I would like to read and conclude the talk. I celebrated 20 years by getting a plum blossom tattoo inspired by a 13th century Southern Song Dynasty bowl at the Cincinnati Art Museum. My understanding is that the plum blossom represents perseverance and hope. I don't know if I represented it properly, but it meant something to me. I saw Dr. Waxman in August. I heard from some of the staff that one of these days you may return and retire back in Cincinnati. Regardless, you are missed after all these years. It was a struggle switching doctors. Joanna is studying ceramic and art history at a small liberal arts college in North Carolina. She got a full tuition scholarship and is very happy. Best to you, Julie. Okay. This is a picture of Julie, Joanna, and the grandma. Actually, Julie's parents retired. After they retired, they moved to Cincinnati to help her to raise Joanna. Her father passed away. Her mother actually also had breast cancer a few years ago. And you know, age is a risk factor for any cancer. So when I look at this picture, I kind of know that when the cancer is diagnosed, it's not all about technology, the newest cure. Just like Julie said, it is also about life, perseverance, and hope. And it's also about the family and the community. Thank you.